changes with time, and the trend is the increase of the percentage of carriage. So the surveillance is one of the topics that we can deal with.
Yes,
Yeah.
but
Okay.
surveillance for what?
Yeah.
How do you use surveillance?
Yeah.
Because we can survey, but after that, what we do
we?
with the data,
Yeah.
is it to evaluate intervention, specific intervention? Is it to report to your ministry? How this can be used? So I think we have to analyze what are the main gaps, as Jean-Yves said, to focus perhaps to identify what is needs.
Yeah. For the surveillance, I think that you're right. And we have two kinds of surveillance. We could have passive surveillance and active surveillance. Surveillance, continuous surveillance through the country to report data, to guidelines, to have guidelines or for treatment. And we could have also active surveillance, such as a tricycle project. And as we are different teams, because passive surveillance need to have more laboratory in the same country.
I would like to do just a small comment.
Okay.
Because I mean, when we talk about surveillance area, right, it's really important. But sometimes we need also to think about the data.
The data.
I mean, we talk about data, metadata, and nowadays, I mean, we have a lot of data actually, website, CDC, but you have to put those data together. And the way when you interpret data from the animal point of view, from the environment point of view, or for the human is different. So I think it's nice, but you also should, if we go in this direction, we should find a way to interpret it and combine those data. This is just to raise a comment on this topic.
For example, in Lebanon, we can use the antibiotic. We have not the restriction for the use of antibiotics in the animal sector. Open.
Okay.
We have not any control for the use of antibiotics in the animal sector in all the country.
Okay. We have Sophia Vasconez. You are from us, Sophia?
Sophia, you raised your hand. You have the floor if you would like to say something to us.
Yes, you are saying Sylvia. Yes. So our Nazareno already said there that surveillance is very important, but we need to look at the data, and I think that Florence also said, and think about intervention. So we can use the data that is already available in our countries and think about what is right now the most important pathogens and what is the sets that we need to improve in intervention, implement intervention. For example, as primary care and use of antibiotic to treat urinary tract infections or respiratory infections, and combining the data using the surveillance and then go to decreasing the prescription of antibiotic, and later on see the impact on the rates of resistance based on different types of infections.
Yeah, that is, I think, a good suggestion when she said common pathogen with which there is a need for intervention. And as we have the low acute respiratory infection as our field, why not searching for AMR in the respiratory infections with which we can deal all of us?
But what about one type of?
That is the point. If I take also the proposition of Sylvia or Sophia, I don't know anymore. she's not.
It's Sylvia. It's Sylvia.
Sylvia. Okay, because the name on the screen is different. Yeah, she told also to choose eventually pathogens from the urinary tract infection. That is in the hospital. That is in the ICU. But all of them then will not be comprised, included inside the One Health approach. So, what else? Yes.
Daniel?
No, excuse me. I'm talking not specifically about urinary tract infection, but my idea was to think about an specific site infection that we can look on the data and think about intervention. And the urinary tract infection is very important at primary care, at community level. It's one of the most frequent infections that we prescribe antibiotic in the world, together with a respiratory infection. So the idea was just to think which is important in each country and try to combine the data and think about one specific infection.
Exactly. I also want to say that.
Okay.
I think we should have one indicator to see that, you know, all of us are working together in the same way, one indicator, one pathogen, as Sophia mentioned, and also our database should be shared among all of us, which is a major, because we all have problems with data, with our networks, with our servers. So what we need is a central server or cloud or whatever way we can deposit our data, and then use one pathogen or two pathogens, one on human health, one on One Health, and then use these as indicators of how the collaboration is working, how the countries are moving.
Okay, that is another suggestion. I would like all the reporter to take it down. Yeah, Dr. Daniel.
Yes, thank you. I have just some points. First, are we considering that we start on the same basis, knowing that we have many differences? The first difference is the COVID-19 management. I've seen for most of African countries, they are using antibiotics. In DRC, it's a clear scheme with macrolide, even C3G, C4G for patients with severe cases. So this is the first point. How will we manage this contrarily of different countries? Second thing is the open access to antibiotics. In my country, I don't know what's about other African countries. Someone has abdominal pain, immediately it's the tetracycline or something like that, or doxycycline. And then we have now the country with specific regulation. And so if we would start a surveillance, we will start at the same basis, or we will need a specific policy according to the country's level of surveillance. Thank you.
Yeah, thank you.
Effectively, your point of view is very relevant. And I think that if we would like to build a kind of network, we maybe have to do the mapping of each team to assess the level of each laboratory or each team, to have a good overview and during the implementation, and who will be responsible for which work package, another work package, regarding his experience, his capacity in terms of human resources.
But I think this could be done once we have the project.
Yeah.
Because the work package is defined according a project. We need to have the main objective, the subtask, and after the subtask can be
capacity
yes,
building.
It's a way to perform capacity building.
It's what I was saying, that we have to do this kind of exercise, to have the opportunity to draw who are not very advanced in their AMR activities. Because since we talked yesterday with Mark, I think that one idea is in our network to have excellency pole. Excellency spot. I don't know if in France, the pole d'excellence. Yeah, we have mainly 3 activities in Gabriel. We have respiratory tract infection, we have MR and tuberculosis. Yeah, we could maybe do a kind of form which each team will fill and have it as a backup before applying, because even we don't have the project, we have to know in our network who is able to do what. This helps us to candidate for potential grants. Oh yes.
Maybe I mean, we already discussed about the expertise of the people involved, and I think there are a lot of expertise here.
Yeah.
If maybe we can just draw an idea of each the topic we would like to work, and then we come up with a. You want to do surveillance? Okay, we can think to find an indicator, as we say. Maybe we can also to find I don't know, to work an idea with a diagnostic tool which could be applied in all the sectors. So consider the human, the environment, the animals. We are also, I mean, we have expertise in this field according with the here with the Merveille Foundation, and as well there will be the possibility to work also with many countries here. And this could be another idea. And then we have, I think maybe we can go some main topics. We have some idea, and then we could select some projects.
Yeah,
I think we have a lot of
there is an
expertise.
intervention here.
I think, for example, in Lebanon, and I think in other countries, we have big problem in sector animal. Okay, the misuse of antibiotics. We have not any control to importation of antibiotics and the use of antibiotics in this sector. I think science focalize in sector animal, for example, evaluate the situation, the misuse of antibiotics in this sector, the presence of resistance bacteria, and finally, we can contact the authority to propose solution.
Okay.
I think, je pense, bon, excuse me, I speak in French more easy. Je pense, il faut qu'on se focalise sur un problème. Non?
Oui. C'est ce
Il
qu'on
faut
devrait tous
qu'on
faire.
se focalise.
Ouais. C'est l'idéal. L'idéal, c'est que l'on trouve...
The same idea. Je pense qu'il faut qu'on se focalise sur un problème. OK? Bon, One Health is very good. Secteur animal, environment, water, human. Je pense le problème majeur, par exemple, chez nous au Liban, c'est l'utilisation non contrôlée des antibiotiques. Les gens importent des antibiotiques, on ne sait pas d'où. La qualité des antibiotiques, c'est médiocre. Ils utilisent les antibiotiques chez les bétails, chez les volailles, n'importe comment. Et nous avons un taux de résistance assez important. Je pense qu'il faut qu'on se focalise sur ce problème, par exemple. Et par la suite, à la fin, proposer des solutions pour les autorités dans chaque pays pour contrôler ce problème.
OK. Graciela?
French before the next week.
Graciela?
Yes. Just to throw ideas, yes. I think that recycle is very interesting, but as much as I have been seeing here, it to spread to make interventions. So what I was, because the pregnant woman probably are from one place, yes, coming from different places. So why don't you think about doing an intervention in a state, for example, in one localized area, okay, or region, I don't know how you call, and there you select, for example, 6 healthcare centers distributed in this area, 6 healthcare centers, and you work with the pregnant woman detection, and in all those pregnant women positive detection of the resistance, you would go the intervention in the place where she lives with a contact with the animals where she works, for example, probably cows, probably chickens, okay, or cats or dogs, and you make the intervention. And in these rural areas, people has the water source from one place also, okay? So you can make a better intervention in one specific area as a pilot model to be reproduced in another rural areas of the country. Because everybody is looking for the hospital most near the place where you work. And so it will be much easier to work with the pregnant woman. And then you have all these no cluster distributions of the E. coli or detection, but you detect it. I don't know if I make myself understood, but I think that it will be a better rural area in a specific region, 6, 7 places. Talk with the region supervisor there and work with the pregnant woman of this area. And with positivity, you go and make the intervention in their houses with the animals and the water resource.
Yeah, that is another scheme of research.
Sorry,
So,
I couldn't understand why we have to focus on pregnant
because
women.
pregnant, it's the one component of the tricycle protocol. It's in the tricycle protocol, we look for the carriage of ESBL E. coli in pregnant women.
pregnant women.
We
It's
use,
health because there are no disease. It's just
Yeah.
for carriage.
Why
Yeah.
why pregnant women you can look for carrier?
Because it's the tricycle
it's easy.
protocol that
It's easy to do the sampling along the delivery, no? And they are considered that,
But
yeah.
we can choose some household, for example, include, but it's more difficult to include people in such a study if they don't come at the hospital. It's the pregnancy is the way to have access.
So if you say pregnant woman, then it gives a different kind of connotation.
no.
Yeah.
Okay,
I
no,
think
no,
that
it's
the-
not linked to the pregnancy.
The idea of pregnant women is that there are mainly the person who come to the hospital
Community, yeah.
Without being sick. They are not sick. The group of people who, yeah, no,
Yes.
not immunocompromised. No, the
Okay.
pregnancy is not a sick. Basically,
Rosa, please tell what people, what medical doctor has to do as a primary center with pregnant woman and the transmission.
Some routinary procedure is to look for some bacteria in our country is a routinary procedure to look in pregnant women in feces some bacteria before the delivery. So it's a procedure routinarily that the pregnant woman goes to the hospital and get one culture for swab. So the same the same sample you can use for looking for ESBL. So for us is practical. Yeah.
And why? I think perhaps an idea, I don't know, but to follow the idea of Graciela, why can we select sites where the carriage of ESBL is very, very low, to identify 1, 2 sites with a carriage very, very low, in opposite to, in the same country, a site, 2 or 3 sites with a carriage very high, and to evaluate the environment of these 2 different sites to see what is the factor that can be responsible of the prevalence of carriage in a place or not, to see if it is the presence of animals, the access of water, the sun, the hygiene, a lot of things to have a very how to say analysis a very fine analysis of its situation of sites with low or high prevalence. I don't know. It's
Yeah, it's among the ideas.
That means that.
Yeah. Hello, I would like
That's-
to make a suggestion. I agree that pregnant women, it's a good population to perform a study, but you add not only colonization, but also urinary tract infection caused by ESBL. And I agree with Florence that it would be very nice to compare different environments and the rates of an ESBL carrier agent in different sites. And then we will have the risk factor. And after the epidemiological study, we can prepare an intervention based on the data. If it is, for example, linked to the social economic level of the population, the neighborhood, if it's a rural area or if it is in a favela without good sanitation. And then we can make a proposal of an intervention based on the risk factor and the different environments and rates of ESBL. But you put together not only the colonization, but the urinary tract infection as well.
Yes, and the idea of Florence of the comparison between low and high incidence of AMR in two different regions is a very good idea. But we have first to have this data before conducting the research for each places. But I think that is feasible.
The first step will be to say
The literature review.
no to test
to
select randomly some sites and to see
it can be 4, 6, 8 sites, and we take the highest and the lowest and we compare the population in those two regions. And
but excuse me, but if you're, for example, if you use the urinary tract infection from the community infection, we already have the baseline data. Because, for example, can just look at the data that all the sites, all the cities or the countries already have in the last 2 years. Then we will already have the idea how it is the low and high level rates of ESBL in each country.
Point. Yeah, it's a good way to evaluate the sites with data, but perhaps I don't know if all countries have this kind of data.
That is the problem, because there are some countries belonging to Africa, for example. We cannot affirm that there is this kind of data in the Ministry of Health. Yeah, but it can be in the first step, as we discussed before.
Well, what I think is that we should be able to formulate a question, a scientific question, in 2 sentences. So I would not be so much afraid of whether we have the expertise or not, because I think if we don't have the expertise, or some of you don't have, this will be, we will do what is necessary to do to get the expertise. But I think that we all together have the expertise, and more than needed. So my angle would be, what is the question? For instance, and also we need to make some choices at a certain point. We can decide to have a One Health project or not. This is a choice. We can also decide to have a common project. This would be my favorite, to have all different countries involved in one project, not in one single, not only one single country, but many countries, because the strength, in my view, of the network is the network. So let's try to formulate questions. I think yes, if you have 2 different sites with low and high ESBL contamination, I would say, in one country or in different countries, the question could be, okay, is the diffusion of ESBLs from the high density equally efficient in the different countries, providing that the environment of this site is different depending on the country. So that's, I think it's a good idea. Just a funny thing, if we were talking about birds, looking for birds in different countries, it's quite meaningless, I think. But if we have kind of fancy and fair and smart knowledge of the trajectories of migratory birds that were born in Bangladesh, then migrate to Laos, then back to Lebanon, and that the right could be a nice project as well. Yeah, if you're interested in how the population is exposed to food, to the risk to food, you can think on the main food source in each countries and look for that. You can look for important food. If you want to have a look on the impacts of certain type of influence on the environment, you can postulate that the different countries do not discharge the same amount of ESBLs or whatever in the environment or at slaughterhouse or in farms, and compare this. And the question would be a kind of comparison between countries on specific risk. This would be my suggestion, but I think your suggestion is quite okay.
Yeah, thank you very much, Jean-Yves. I would like to build a sentence like he proposed on the idea of Florence before. What are the different factors which explain the differences of prevalence between two regions? And we have then to show at the beginning the difference of percentage of carriage before conducting the research. So we have to take all of in a questionnaire or also with surveillance of patients with it, the different data that we can have in animal, in human, and in the wastewater around the region. But the sentence that he proposed perhaps must be written first, so that we can go on further in the search for the different steps to be done. Yeah, Graciela?
Sorry, in two regions or in two communities, distant communities of one region?
It depends on it depends on the results of the first preliminary research, if I can say.
Yes.
We have to test
I have one question for everyone. We have different levels of healthcare system, yes? Primary,
yes,
secondary, and tertiary. If we talk about the secondary healthcare level, we have in different regions, yes, the secondary. So you can make a first screening, knowing the place of the pregnant woman, for example, in the secondary, okay? And then you have a picture of the region where the secondary hospital is, okay? And after that, you decide which 2 or 3 primary healthcare centers will have the intervention with the full picture of the analysis of the human, animals, and environment.
I think that this can be discussed lately, but yeah, but that is the kind of thinking that we must have in the future. In which region we have to take the samples for the first step first? Is it in primary healthcare or secondary, as you said, or in tertiary healthcare? It depends on us. But the step now is to first ask everyone, are you agree with the fact that we have to compare two regions? Yeah? Yeah?
Yes.
Yeah. And after that, we have to search for the factors which explain the difference between those two regions in the 3 sectors. Is that sustainable? Is that feasible?
I think that we don't need now to say that we go in this direction. Perhaps it could be also interesting. Another idea is to see the relationship between the countries concerning the different trades, the food trades, and to see how the trades can introduce resistant pathogen in the country. And as we are in network, it could be interesting to see what is the relationship at the commercial levels between the different countries, and but I don't know if it is feasible, but it could be more original, perhaps. I don't know. It's another idea.
It's another idea. Yeah. So you talk about food chain in different countries. Yeah, that is another proposition. You have to take it. Food chain in a big market or in a small market. What kind of food chain we have to take? On vegetables?
I don't know.
On chicken?
I don't know. Chicken or...
Yes, Glaucia?
Yeah, I'm just wondering, because the goal of this brainstorming is to make together a multi-center study about the antimicrobial resistance. Why? I don't know, it's just an opinion. Huh? Why you don't take the first project that you already set up with Cameroon, Brazil, and Madagascar, and enlarge, because to ask funding, you always need results from the first results to make more strong a grant. In my area, it's like that. It was like that. So does make, for example, take the antimicrobial resistance in patients, in wastewater, in animals, in the era of COVID. I don't know, it could be, I think, a start point to go on. Because for antimicrobial resistance, you can discuss all the night for different projects to do a lot of things.
Yes, the idea to take the research from a research which is already existing is very interesting, but the problem before is that there is a concern with this project. What is the hypothesis? That is what Graciela said before. Is the CoVIMR directly linked to the IMR, or the measures that has been?
For example, as Sylvia, you can take, for example, some countries that you have the antimicrobial resistance before the COVID era, and compare it to this during the COVID or post-COVID. I don't know, but I think you have a base for comparison.
What would be the impact? It's a descriptive study, but how to?
No, it was not descriptive. It will be emergent of AMR in the era of COVID. It's a question.
Valentina?
It's for this reason, but you have the epidemiology in Bangladesh that is completely different of COVID than in Brazil or in India, for example. I don't know who will participate, but I think this point is interesting. Madagascar, that the prevalence of COVID is very low, as I understood.
Yes, but the IMR is very high. So it's difficult to link.
But there is a relationships or not?
Yeah,
we don't know.
Yeah, let's take that this idea is to use already existing research to the network. But let's listen to Valentina, because she has raised the hand for a long time.
So I was thinking that
Yes,
just a
it's-
thought, okay? What you would like to do is surveillance or a research project? You know, because if you are doing surveillance or you want to implement surveillance, then maybe reaching out to current surveillance that exist in surveillance. Even during the IMAR course last week, we observed so many surveillance where they will be willing to reach out to new people to integrate this ongoing surveillance either on humans or either on only animals. You remember, Janice? So I think it would be nice to kind of reach out that. Now, if it's research, basically, again, like I said this morning, why not about trying to mutualize thematics that are existing at la Fundación? I mean, we're trying to kind of push forward. For example, I'm talking about the acute respiratory infectious thematic, and try to join these forces with your idea on IMR and mutualize potential efforts on that end. Just
Yeah.
comment later.
I'm gonna turn to all the different laboratories. We're gonna do surveillance or research. Yes.
I think our mission remain the detection of a problem and the proposed solution. The main source of dissemination of resistance bacteria, human and animals. In human sector, we have big problem and misuse of antibiotics. For example, in Lebanon, you can buy antibiotic without ordinance. Okay, and the big problem, we have many activities now in a human sector to control the utilization in antibiotics in the hospital and outside hospital. Okay, the main source of resistance bacteria remain human, and in the sector animal, we have the same problem and more complicated. I think our mission remain the detection of the problem and propose the solution for the community, for the authorities, and so on.
Okay.
Okay. Yes, Tausi.
I agree with the comment that every region is different, everybody has different problems, but if you want to make this successful, you have to make it different from other existing consortiums. You know, we're saying a tricycle, this and that, and so many things, where people are looking at One Health. What makes this difference is COVID. With COVID, at least in our country and neighboring countries, antibiotic use in humans has been increased 100 times. Everybody gets an azithromycin or what else do they get? A lot of azithromycin, doxycycline, randomly. Have COVID, take this. And so what is it doing to the AMR? I don't know about other countries in other regions in the Gabriel, but this is something that would be very important to focus on. That would make it really important to get the funding.
So the suggestion is?
Yeah.
So the suggestion is?
That you should make it a post-COVID or ongoing COVID sort of a proposal.
Okay.
Because we are all facing COVID. We are all using antibiotics to a degree that we never used before.
Yeah, there is a question from Delia Goretti.
I don't know much about this topic, but I was here to learn from you. And I was touched by what the Lebanese colleagues said. So the problem is basically the humans that don't use well the antibiotics. So in this proposal that you are going to do, that has to be decided yet, no? Because you need to detect the microbial resistance in the way you will decide. On a side, you can put the possibility to do education. So the connection with the government people that do the regulation will be very helpful. So the educational part to the physicians, to the veterinarians, to the people that you target will be crucial. And in such projects, this side part is always well taken, especially because you want to go to the public health related issues.
Yes. Try to talk on.
So it's not also my area, but I would like to. So I think what we already said is we like to try to identify some conversions so that we can use the network to build our research activities. So I'm really following, I don't know who talk about the really ongoing project. So we have already one project going on in Madagascar, in Cameroon, in Brasilia. We've already SOP, already some preliminary results. So we can build on this to see how we can extend. I really understand what the professor of Liban is saying, but we have different institutions. Some of the institutions are public health, other are universities, another are in the Ministry of Research, I don't know. But I think what we are sharing in common is research activities. So instead of building in a new, like we like to have a new subject, we can build in an existing one.
Okay.
It's now 6:20. Normally it could have been ended at 6. Do Florence think that we have enough ideas to go forward, or we must stay longer?
Yeah. Roadmap.
Yes.
I think it will be not possible to do to finalize today. It's but I think we have some different ideas. We will keep all the ideas for the moment, and I think with Laurence and Jean-Yves we will think about, and we will organize a working group in January, I think, not in December, but in January, with more precise points, and we can share before to you, and after we can and we will discuss. Okay? Is it okay for you?
That's okay. That's okay.
Yeah.
So both of you have to summarize the discussion. Yeah, it's better for you to have one laptop and to see what are the different ideas. Okay, so at the end of the afternoon, we thank you all for your active participation.
Thank you very much for your presentation.
Yeah, I give to Florence the last words.
I would like to thank you, the chairman, that
thank you.
Made their job very well. Thank you, all of you, for your participation, the speakers. And if you have, in the meantime, new ideas,
thank you.
Do not hesitate to share with us.
Okay.
Okay. So we have dinner at 7:30 to relax a little bit. Thank you.
Thank you.